Now we're going to review preoperative antibiotic selection. These are antibiotics you give between 0 and 60 minutes before the skin incision of a surgical procedure, and they help protect the patient against surgical site infections. For most surgeries, you're going to want to give preoperative antibiotics from 0 to 60 minutes before the skin incision. So best case scenario, just give it immediately before or start running the antibiotics during the timeout. If a patient's on scheduled broad-spectrum antibiotics, they don't need additional preoperative antibiotics, unless you're trying to cover for anaerobes or something that they're not currently being covered for. So first, you should think about two types of surgery. Surgery that does not involve bowel or cutting through the bowel or bowel wall. So here's a list here. Hernias, ports, cholecystectomies, because the bile system is usually sterile, and even hysterectomies. Then there's also surgery that does involve bowel, where you also want to give the patient some anaerobic coverage, usually with flagyl. Bowel resections, Hartmann's takedown, and appendectomies. So the first category of surgery are the ones that don't involve bowel. So for that, if the patient has no penicillin allergy, you're going to give Ancef or Cefazolin, 1 grams or 2 grams, based on whether or not the patient weighs less than or greater than 80 kilograms. Now, some surgeons use a cutoff of 80 kilograms, some use 100 kilograms, and some use 200 pounds, which is about 90 kilograms. I think it's easier just to use 80 kilogram as the cutoff, so there's no issues with the timeout. If all attendings will pretty much be okay with 2 grams Ancef for anyone that's over 80 kilograms. Next, you have the patients that have penicillin allergies and are having a surgery that does not go through the bowel. For that, you're going to use vancomycin, and this is for the high-risk allergies. In certain cases of low-risk allergies, you'd still be okay giving the Ancef. Now we move down to surgical procedures involving the bowel, and for a patient with no risk or low risk allergy. Best case in terms of working well and being cost effective would be the Ancef and flagyl. It's going to be 1 or 2 grams of Ancef and 500 milligrams of flagyl IV. If there's so alternatively you can use Cipro and flagyl or 1 gram Invans. Maybe if it's a longer operation and you don't want to have to worry about redosing antibiotics, which you would typically do, it depends on the half-life of the antibiotic, but usually around like 4 hours or so. But Invans is longer acting, so you won't have to worry about that. Or if there's a lot of blood loss, you think about redosing the antibiotic. If the surgery involves bowel, and it's a high-risk penicillin allergy patient, you could give Cipro and flagyl or Invans. So next up, just a few notes. These are some broad-spectrum antibiotics where you usually don't have to give additional preoperative antibiotics, ceftriaxone, Herceptin, piptazozocin, Mirum. Then also for any questions, you should consult this book here, which I showed you guys in one of my other videos. It's got I guess on page 193 it has all these listed out and a little bit more detail as well, and with a little bit more specifics, but this is a good general overview. For penicillin allergies, most physicians will consider rash a low-risk allergy, and then depending on who you talk to, hives and an unknown allergy, which hives is essentially, from a patient's perspective, they're going to have a rash, and if you ask them if it itches, they say it itches, it's probably hives. Some, depending on the scenario, you could either still give a cephalosporin if they have a rash or unknown allergy, or you may choose to give a non-penicillin, non-cephalosporin. So rash or hives and unknown could either go as low risk or high risk. But rash is low risk. Then high risk, down here you can have your anaphylaxis, angioedema, breathing difficulties. Those would make you want to use not even a cephalosporin, except in some cases, some cephalosporins with low cross-reactivity like Invans or Mirum, you may still be okay to use those, just depending on the risk and benefits or if it's an ICU patient and you want to change the antibiotics around but still keep it really broad spectrum. So that's it for now.